From our general and specialized medical experience for more than 40 years, especially in the theoretical, clinical and surgical specialized practice in diseases and surgery of the ear, nose, throat, head and neck, we have discovered new methods in some surgical operations such as operations on tonsils, adenoids, corneas, tonsils, sinuses, and nasal and auricular polyps. And others. The summary diseases of the ear, nose, throat, head and neck and their surgery, and in Waji's Mallouhi Medical Encyclopedia. We also discovered a group of clinical signs diagnostic of many important ear diseases with a positive rate of up to 95%. It has been deduced, programmed, and documented for decades, practically and theoretically, and confirmed from hundreds of pathological cases studied and consistent theoretically, practically, clinically, endoscopically, and planning. Radiologically and surgically, the presence of this clinical sign greatly reduces the number differential diagnosis diseases, confirms the type of disease and its diagnosis simply by its presence in irregular otoscopy and examination and visualization of the anatomical features of the tympanic membrane and its normal changes. Anatomical, functional, and pathological. The correct diagnosis of the disease is treated accurately by the wise doctor and the patient is cured, which saves its time and effort and money, and the junior specialist doctor can confirm his diagnosis laboratory, planning and radiological. Until he can gain clinical experience, documented methods for diagnosing diseases and reducing costly investigations for the patient as much as possible. But what is Mallouhi's clinical ear sign? Tympanic membrane. Tympanic membrane. Tympanic membrane is the lateral wall of the middle ear cavity. It is made up of a very thin, highly tense and elastic layer that separates the external ear from the middle ear. This membrane is made up of 3 layers, a mucous membrane in the medial and skin in the lateral, which is in contact with the skin of the canthus, and between them is a layer of radial and circular elastic fibers. The natural view of the tympanic membrane is transparent. The book can be downloaded from the web for details. In short, most diseases of the closed ear such as obstruction of the pharyngeal tube due to various causes, then serous otitis media in its various degrees, serous, mucus, and cerumen, and other diseases such as hematoma of the middle ear and jugular glomus tumor in its early stages inside the middle ear. The right angle changes from right to acute in the early stages of serous otitis media, for example, and with the progression of the pathological mechanism. The angle becomes obtuse to various degrees. In otoscopy with normal examination, we estimate the angle as acute, right or obtuse. And for each closed ear disease, there is a specific qualitative angle that diagnoses this disease in addition to the history and the rest of the symptoms and signs. And practically, we shorten most of the expensive investigations. And we confirm that sign clinically, planning, radiologically, and surgically. Thank you and appreciation.